We now move into the topic that deeply affects the day-to-day lives of millions of menstruators. Managing PMS, discomfort, anemia, and menstrual-related illness. The session brings together medical specialists and practitioners who have dedicated their careers to women health and menstrual well-being. Please put my hands together. And today, leading the panel is Dr. Santosh Gupta, Associate Director at ARMMAN, an organization known for advancing maternal and child health using technology and innovation. Joining the panel are Professor Dr. Shehla Jamal, President and Founder, Society of Menstrual Disorders and Hygiene Management. Dr. Divya Radhakrishnan, Founder and Chief Doctor, Hygeia Homoeo Clinic. Dr. Smita Dube, Obstetrician and Gynaecologist, Kilkari Hospital. Dr. Taude Kilkari, Associate Professor and Head Digital Health Center, MUHS. Let's welcome them with a warm round of applause. Yeah. I would request everybody to please settle in. We are just starting the session. And I would request everybody to keep your phones on silent, unless until it's your period cramps. Start handing over to you, sir, for the panel discussion. Can we have a round of applause for them? Let's motivate. Thank you for the encouragement. Thank you.
Thank you, ma'am, and very warm welcome to all the audience. And I think this session will be very kind of the medical consultation to all the doctors in the panel. So, starting with Dr. Smita, ma'am, welcome. And thank you for this gramalaya team to hosting us as a speaker and conducting such a wonderful topic. So, ma'am, as our topic especially related to the medical management, what is the premenstrual syndrome, that is leading also the flow for the anemia, and also the illness related to the menstruation. Okay, so all these are the live questions. Just moving to our next eminent gynecologist, Dr. Shehla. We all know that premenstrual syndromes, they heard about the kind of problems they faces. But point of view from the expert, what is the PMS basically, and how it differs from the premenstrual dysphoric disorder? How we can tackle it? Not as part of the medical expert, but as a part of the audience also, how they can understand what are the preventive measures on that. What is your take on that?
Thank you, Santosh sir. So men in the house, please make a noise. Men. हाँ.
I'm also here.
Yes, yes. So premenstrual syndrome, बहुत everybody comfortable in हिंदी? आती है ना सबको? ठीक है. No हिंदी? I'll explain. So you all know the females around you. सबको घर में कोई ना कोई है लेडी, है ना? पति जो होंगे वो कभी कभी पिटे होंगे. Not in that sense, कभी तो बेलन एक बार कभी तो पड़ता है, हाँ. और भाई हमेशा तड़पाए जाते होंगे और बेटे हमेशा सताए जाते होंगे. Not in those literal sense, but yes, from a woman's perspective, it is that time of the day when a woman feels very, very different. She herself will not realize कि मुझे हुआ क्या है. एक पॉइंट में वो आसमान में और एक टाइम पे वो आपके पास किसी तरह का रूप धारण करके खड़ी होगी. So she is undergoing a myriad of changes because of the hormonal fluctuation. The whole menstrual cycle is dependent on estrogen and progesterone. Estrogen चढ़ा देता है आसमान पे, प्रोजेस्ट्रॉन भाई बहन का खेल चलता है, ईस्ट्रोजन इज सिस्टर, एंड एज सुन एज ब्रदर एंटर्स वो कहता है अरे ये क्या स्टाइल मार रही है, चलो नीचे आओ. सो एज सुन एज प्रोजेस्ट्रॉन एंटर्स द बॉडी आफ्टर ओव्यूलेशन, ईस्ट्रोजन की तादाद भी कम होने लगती है. और एक टाइम आता है जब दोनों भाई बहन लड़के बहुत ज़्यादा घर से बाहर चले जाते हैं कि चलो हम चलते हैं. सो दैट विड्रॉल ब्रिंग्स अबाउट द मेंस्ट्रुएशन. सो जब वो विड्रॉल होता है दोनों हार्मोन्स का विच आर एसेंशियल फॉर आवर मेंटल एंड मेंस्ट्रुअल हेल्थ, तब हमें बहुत प्रॉब्लम होती है. एंड व्हेन आई से हमें, इट इंक्लूड्स मी ऑल्सो. माई मूड गोज बैड, आई समटाइम्स मे शाउट, आई समटाइम्स मे फील वेरी इलेटेड, आई हैव क्रेविंग्स, आई हैव डायूरेसिस, बार बार यूरिन आने की प्रॉब्लम होती है. कुछ लोगों को हेडेक, कुछ लोगों को डायरिया, कुछ लोगों को पति अचानक से बहुत बुरा लगने लगता है कि कहाँ फंस गई मैं. कुछ लोगों को अपने माँ बाप से नफरत हो जाती है अचानक, कह रहे यार इतनी भी अच्छे नहीं है जितना हम सोच रहे थे. सो दैट इज़ प्री मेंस्ट्रुअल डिस्फोरिक डिसऑर्डर. अब मैं बात करूंगी प्री मेंस्ट्रुअल सिंड्रोम, जिसका भी नाम बदल के PMDD हुआ है. सो प्री मेंस्ट्रुअल सिंड्रोम ना कह के हम उसको प्री मेंस्ट्रुअल सिम्टम्स बोलते हैं. दोज आर एसेंशियल पार्ट्स एंड दैट मेक्स अ वुमन अ वुमन. ये हमें जब फील होना शुरू हो जाता है, कुछ लोगों को हेडेक होना शुरू हो जाता है, बैक एक होना शुरू हो जाता है, आपको क्रेविंग्स बढ़ने लग जाती हैं, लगता है कि अब से 5 से 6 दिन बाद मुझे पीरियड्स आने वाले हैं. सो सिर्फ और सिर्फ उस सेंस में वो प्री मेंस्ट्रुअल सिंड्रोम या सिम्टम्स हैं. अगर जो मैंने इससे पहले सिम्टम्स बताए वो प्री मेंस्ट्रुअल डिस्फोरिक डिसऑर्डर हैं. सो ऑब्वियसली वन हैज़ टू आइडेंटिफाई PMDD because it may not be very visually affecting you, but in absolute sense, like at your workplace, with your partners, with your co-workers, it may affect relations, it may affect work productivity, and it may affect your own insights and perspectives towards life also. आपके डिसीजन अगर PMDD में हो गए ना, लड़के को हाँ बोल दिया PMDD में कि अच्छा है, और फ़ौरन जैसी पीरियड्स आएंगे कहेंगे यार ये ऐसा भी नहीं था, ये डिसीजन नहीं लेना था. सो इट इज़ काइंड ऑफ दैट सिचुएशन जहाँ पे हमें बहुत ज़्यादा अवेयर रहने की ज़रूरत है. वी हैव टू आइडेंटिफाई व्हाट वी आर गोइंग थ्रू एंड टू टैकल. सर 2-3 चीज़ें हैं टैकल करने के लिए. फर्स्ट इज़ आइडेंटिफिकेशन कि मुझे ये हो रहा है. सो देर इज़ ऑलवेज अ पैटर्न रिकग्निशन इज़ वेरी इंपॉर्टेंट. सेकेंड इज़ सिवियरिटी एंड इंटेंसिटी. जब हमें पैटर्न पता होगा तो हमें सिवियरिटी और इंटेंसिटी भी पता होगी. अगर वो सिवियरिटी और इंटेंसिटी बहुत ज़्यादा है देन विजिट अ गायनेकोलॉजिस्ट. वी ऑल हैव मेडिकल मैनेजमेंट फॉर दिस. अदरवाइज बहुत सुंदर सी रेमेडी है, सब लोग ट्राई करें. मेन भी ट्राई कर सकते हैं, इनको भी होते हैं कभी ना कभी कुछ ना कुछ. सो मेंस्ट्रुएशन नहीं होता बट सर PMS टाइप की बहुत सारी चीज़ें होती हैं. अचानक बीवी बुरी लगने लगती है और दूसरे की अच्छी लगने लगती है. नहीं सर,
अभी इसमें मेरा कोई कमेंट नहीं है.
सो व्हाट यू हैव टू डू, जब भी प्री मेंस्ट्रुअल फेज में आप एंटर करें, ईट सोक्ड आलमंड्स एंड स्टार्ट योर डे विद बनानास. सो ये जो 2 मैग्नीशियम डेफिशिएंसी की वजह से ज़्यादा प्रीडोमिनेंट हो जाते हैं, ये 2 बहुत इंपॉर्टेंट चीज़ें हैं. सेकेंड इज़ वन हु इज़ ऑलरेडी हैविंग एनीमिया, her symptoms will be more exacerbated, like lack of concentration, chidchidahat, ghabrahat, the feeling of giddiness and all those stuff. They become more prominent if the girl is already anemic. So treat your anemia well before in time and well, like taking proper medications. For this, we have lot of remedies at home also, but as a doctor, I'll suggest take some iron tablets after consulting with the doctor. And third is include curd in your diet. So curd is a pre-probiotic mix. It improves gut, and we have this gut dysbiosis, which is, I think Smita ma'am will agree with me. We have a lot of research, lot of papers telling us that gut dysbiosis is a major cause causing premenstrual dysphoric disorder, as well as premenstrual symptoms which are exacerbated, dysmenorrhea, heavy bleeding, and irregular cycles. So that's all from my side for PMS.
So thank you very beautifully. I think you quoted the live examples. Our audience are connected. So just it's extension of the question regarding this. So having this kind of the fast food and that unhealthy diets that also exaggerate the problems during the menstruation. What is your take on that?
Sir, I have very different take on this. People do say कि junk food नहीं खाना है, पिज़्ज़ा नहीं खाना है, पास्ता नहीं खाना है. और मेरा ये मानना है कि ज़रा से खाने से अगर आपकी लाइफ अच्छी लगने लगती है आपको, तो ले लीजिए. वी ऑल नो द क्वांटिटी, वी ऑल नो कि हमें कितना खाना है. अगर इतना सा पीस ऑफ चॉकलेट लेने से मुझे मज़ा आ जाता है तो मैं तो ले लूँगी, बिकॉज आई नो आई विल बी बैलेंसिंग इट लेटर ऑन. आउट एंड आउट एज अ हेल्थ केयर प्रोफेशनल आई विल नेवर प्रोफेस जंक फूड और अनहेल्दी फूड. बट वो टाइम डिफरेंट होता है. जैसे मैंने भी कहा, व्हेन यू आर क्रेविंग फॉर समथिंग, उस टाइम आप सिर्फ लड़ झगड़ के किसी भी तरह से करके वो खाना चाहते हैं. सो इफ़ दैट मेक्स यू हैप्पी, go for a bite, always in moderation and always having a mindfulness at the back of your health chart. So yes, but never to be had in, regularity. I've seen so many girls coming up to me कि हमारा रात में बैंक वाला काम है, हम अमेरिकन बैंक के लिए काम कर रहे हैं, हम ब्रिटिश बैंक के लिए काम कर रहे हैं, or whatever companies. You are making those people rich, grow by your intelligence. और रात में क्या होता है, वो स्विगी और जोमेटो ही आता है. किसी के पास इतने स्ट्रेंथ नहीं बचता है रात में कि हम उठ के खाना बनाएं या कुछ करें. मेजॉरिटी ऑफ द पीपल आर लिविंग ऑल अलोन, फ्लैट्स किराए पे रह के. तो मुझे भी कहा जाएगा कि रात में 3 बजे मैं उठ के खाना बनाऊँ, मैं भी नहीं बना पाऊँगी, इसलिए लेकिन मैं पहले बना के रख लेती हूँ. हाँ, सो कीप ऑल दोज थिंग्स, ऑल दोज डायरीज, टू डूज लिस्ट prepared beforehand so that you don't have to fall clutch to this chronic cycle of junk food and craving and eating. और दूसरा एक मेरा मानना है इसी चीज़ के साथ, अगर मैंने कभी पिज़्ज़ा नहीं खाया तो क्या मुझे उसकी क्रेविंग होगी? तो खाना ही नहीं है पहले. तो जंक फूड, अनहेल्दी फूड से जितना दूर रहेंगे, क्रेविंग्स नहीं होंगी. बट येस, अगर एक पीस छोटा सा कुछ इन मॉडरेशन आपको हैप्पी बनाता है, यू कैन.
थैंक यू. सो अपनी खुशी का ध्यान रख सकते हैं हम लोग, डेफिनेटली. सो इट्स वेरी वैलिड क्वेश्चन बिकॉज द टीनेजर्स आर आल्सो यंग एडोलसेंट गर्ल्स आर हियर. सो आप ले सकते हैं बट बैलेंस में. ओके, थैंक यू डॉक्टर शैला. एंड मूविंग टू द अवर नेक्स्ट पैनलिस्ट डॉक्टर दिव्या, because Dr. Divya belongs to one of the holistic approach of the healing system. She is a homeopathic physician. So actually just best we would like to know about what is the role of homeopathy and Ayush basically in the treatment of the menstrual problem, and how this has to be has a scientific backed data, and what are the live examples in your clinical practice. Yes ma'am.
Thank you, sir. So we were listening to many lectures. Thank you, sir. So we were listening to many lectures since morning. And basically, I would like to start from this. See, disease enters through 5 sense organs: the eyes, the ears, the nose, the mouth, and the skin. So we saw various things related to skin, how we have to clean everything, disinfectant, the pads, it has to be cleaned, and everything. So now we saw about diet also, which is through the mouth. Because when we eat too much of food that is rich in chemicals, then it causes hormonal changes. So the disease enters through the mouth. And there are some disease which enters through the eyes and ears, right? We can think how it enters through the eyes and ears. Those are psychological illness. Like for example, we are like seeing an accident, get impact towards that, or seeing some sensational scene in films or wherever it is in YouTube, which impacts us deeper. It can be a harm to an animal or harm to human beings or whatever it is, X, Y, Z. So that impacts us. Similarly, how the disease enters through the ears. Like we hear some bad news, right? The death of the loved ones or etc., whatever it is. Then when we hear such news, then it affects us, right? It impacts us and cause disease in the body. How? Through hormonal changes. So this is where homeopathy comes into picture basically. So homeopathy is all about individualization, because no two individuals are same, right? Even they are siblings, even they are own like sister and sisters, they are not same. In PMS, their symptoms are different. In every fibroid or polycystic ovarian disease, their symptoms are different. So homeopathy differentiates, be at physical level, like during the menses, what are her symptoms and what she likes to do, what are her aversions. So differentiation comes at physical level. Then differentiation comes at emotional level, because some will become quiet during that time, some will become violent, they throw temper tantrums, violent anger they show. Okay, it's not like everybody behaves in same way. So their emotional changes are different. So during that time, what is the emotional changes? And also the changes in the body during that time. For somebody, during anger, there will be trembling in the body, right? For somebody, during anger, there will be headache. And during headache, they want to go and sleep in a dark room. So everything is a symptom in homeopathy. We see it as an individual. Beyond that, beyond emotional level, when individualization comes, it's at delusional level. For example, right now we are here. So we all of us get angry. We all of us get fear. We all of us become anxious at some point of time. But the reason for which we are fearful and the reason for which we are getting angry, the reason for which we are becoming anxious differs. And that's how the behind that emotion there is a delusion. Like for example, she did not respect me, and so I'm getting angry. So it's my delusion that she did not respect me. So there comes the picture of delusion. So what happens when we treat the disease based on individualization in the mind, then holistically the changes happens. And with this, I would like to give examples, as you told, the clinical examples, because the disease travels from mind to body, right? So when we see only body, the symptoms palliate, but not it improves holistically. So that's how the disease travels from mind to body in P and EI axis. P stands for psychological, N stands for neurological, E for endocrine, which is the hormones, and I stands for immunological. So disease starts from mind, psychological, then it affects the nervous system, then it affects the hormones, and then the immunology gets disturbed, and we land up in disease like PCOD, fibroid, amenorrhea, like painful menses, dysamenorrhea, so etc. That is the diagnosis aspect. So now when the patient comes to us, we see in reverse direction the disease, then what was the cause of the disease, the emotions and the delusions and the core psychological factor. So I would like to give few examples for that. One of the girl, like she was experiencing a bad touch in a public place. All of a sudden she got shock, and she never expressed this to anybody else, because she thought if I tell this to friends or mother, they will scold me. So that is her own delusion. So she did not speak about it to anybody. She kept it within herself. She lost her. So what happened? The stimuli was the external bad touch, and her psychology got affected. And her own delusion is that if I tell this to somebody, then people will think wrong about me, scold me. And that lead to emotion, which is the fear. She did not mingle with people after that, and she was about to get married in 1 month. So mother was so much stressful that she is not talking with anybody. I don't know what happened, because mother did not know about this incidents. So she was fearful of every male, and she is telling that I don't want marriage also. So this is emotional botheration, and because of that her sleep disturbed, she did not eat, and her menses became irregular, and all the reports were normal. So mother brought the child for treatment, and every history was explored. And when this remedy for that shock, when it was given, completely there was change. Like her sleep became improved, menses became regular, and she got married also last month. That fear of males, that disappeared. So this is how homeopathy works holistically.
Thank you, Dr. Divya. So, coming to you, as a gynecologist, because you are practicing gynecologist, you also have done kind of the awareness program in the heart of India, that is Madhya Pradesh. Okay. So, how you guide the adolescent girls, women and parents, even the community workers, what are the red flag symptoms during the menstrual cycles, and how we can manage pharmacological and non-pharmacological way? Yes, ma'am.
Thank you for the question, sir, and thank you, Team Gramalaya, for having me here. Thank you. Very nice question, sir. So, what are the red flag signals? This is very important. Why identifying the red flag signals matter? Because early detection of serious condition, we can improve the treatment outcomes, and some menstrual symptoms are indicative of medical emergencies. And if we give treatment at the proper time, and we evaluate the patient and we get the patient at the proper time, we can have timely intervention which can prevent long-term complications. So before we know that what is abnormal, we all should know what is normal. So whenever I take my sessions, we start with what is normal. So normal in terms of cycle, in terms of bleeding, in terms of pad, how many pad the women or the girl is changing, and in terms of pains. So in term of cycle, what is normal? We take 21 days to 35 days as normal. But latest I have heard that, I have not gone through that literature, but now they say that 45 days they are taking normal. Because so many times the girls come that they are having irregular cycles, it is not getting on time. So exactly 28 days we don't take as normal. It is 35, maybe now 45 days we take it as normal cycle. Then it comes to bleeding. So bleeding 3 to 7 days is normal. If it is less than 3 days, if it is more than 7 days, then the patient or the girl has to consult the gynecologist. Number of pads that is being changed, that the girl or woman is changing. That is, if a girl or woman is changing pad in less than 2 hours, one pad in less than 2 hours, and that continues, then that needs medical attention. In terms of pain, pain is when it is affecting her daily life, daily activities, then she has, and it is not relieved by the simple symptoms like hot water bag, rest, then she has to take consultation with the doctor. So what does we, elaborating these signs, we say that when the girl misses school because of pain, when the woman is not able to go to her work because of pain, then that needs attention. If she gets pain and she faints, if the pain is not getting, that I have already said, that it's not getting relieved by simple measures, if the intensity of pain is increasing month by month, like before it is less, then every month it is increasing, and when she gets pain, when she is not bleeding, without bleeding also if she has pain, then that needs to have a consultation with a doctor, that is gynecologist mainly. Then in terms of bleeding I have already said it should be, if it is more than 7 days, if she is passing clots, or no time passing clots in periods is normal. If she is soaking pads, one pad in less than 2 hours, it is abnormal. If she is not having period for 3 months, or if she has bleeding after sexual activity, then that is abnormal and that needs immediate medical attention. The other sign which we come across is foul smelling discharge, because white discharge is a very common thing, and every other person complains, all because they have a myth that because of that white discharge the bones are melting and they are getting weak. So all white discharge is not abnormal. Patient, there are glands in the vagina outside, they have secretions, and the secretions, they keep the vagina healthy. So abnormal white discharge is when you get pain with the white discharge. If it is foul smelling, you get itching. The color, normal white discharge is like pale cream. Then if the color is changing, then you have to have a consultation with your gynec doctor. Then other things is that what is PCOS? PCOS is a very, like, from morning only, it is like a COVID, everybody is saying that when we are getting one more epidemic, every fourth girl is suffering from PCOS. It is not related to any age, everyone is having bleeding irregularity. Every fourth person, every fourth woman is coming with the period problems. Then some are having period problems, some have excessive blood growth, some have irregular periods. Sometimes the patient have increased bleeding and pain because of other problems in the uterus, some growth in the uterus, we call them fibroids. Sometimes if the bleeding is more slowly, they are losing blood and they are not taking that much iron, so slowly they get anemic. The schoolgirls, their performance is affected. In older females, they get weakness, they get dizziness, they feel weak, and the infection also, they sometimes lead to infertility and other serious problems. So we need to acknowledge, we need to know what is normal and when to refer the patient or girl, that everyone should know, or maybe you should know so that you can guide somebody, that if someone in your contact is having such problems, they should not ignore and consult a doctor. So what is abnormal? To be taken it in simple words: too painful, too heavy, too long. You should go and consult the doctor. So the period should not make your life stop. So the best way to champion women's health is to empower them to speak about their bodies, and they should know what is normal and what is abnormal. Thank you.
Yeah, thank you, ma'am. Very wonderful. So, as we know that menstruation is for generation. Okay. this menstruation is very crucial for the one's life as a woman, as a girl. Could you please I wanted your opinion. What are the role of creating awareness among the communities? Because as being a medical professional, definitely we talk about the pharmacological management and even the non-pharmacological management. But what about the awareness among the community? So what are the normal conditions where the community know how we can manage these excessive discomfort and excessive bleedings? So could you please explain in the short so our audience can understand?
Yeah, thank you, sir. Together, see, this is one thing which only gynecologists or doctors cannot handle. So, from the morning, here is a team of so many people from different fields, and we have to have a knowledge and we have to come together to deal with all these situations. So by doing this, we have to have government people, we have to have NGOs, we have to have gynecologists, we have to have the people who are creating these innovative solutions, the apps and everything. And this is how we can create awareness among the people. Like menstrual periods, and we have to have some diet sessions because the girl is bleeding every month. So we have to educate them to have more iron in their diet. Then with hot water bags, simple solutions, some simple exercises. Then the environment also comes in. So we have the reusable solutions also. We have to guide them because they are not getting that. Unless until we reach out to the community, nobody is going to tell them about that. Even, you won't believe, even in doctors, so many people don't know about menstrual cups. And when you talk to them, acha, kuch aisi cheez bhi aati hai, so nice, it is so nice. And sometimes they know, but they hesitate to use it. So when it comes from a reliable source, when your queries are solved, when your fear is answered, then you are more empowered to use the things. And obviously about the exercise, like in PCOS, it is most of the time, it is the diet, the exercise, the stress levels, the new girls are going through, and sometimes that has come in the disposable pads. We don't have any studies. When I was preparing for a talk in Riva, I went through many papers, and I've found that there were no Indian studies about those chemicals in the disposable pads which were there. Only few studies that some NGO has done, and most of the studies were from foreign countries. So that we need to have more studies on this so that we can have some evidence-based guidelines on these conditions, and we can more comfortably and more confidently tell them to switch over to reusable pads.
Thank you, ma'am. Very beautifully explained. Thank you, Dr. Shehla, Jamal, Dr. Smita, Dube, because this is kind of the medical consultation and knowledge sharing from the medical background, but I'm open for the questions from the audience. So please, if you have any kind of the questions and discussion, please feel free to ask. Please. Yeah. पैसे की बात करना, हाँ पैसे की बात. बट अगर आपके पास कोई सवाल हैं रिलेटेड टू द menstrual disorders, any kind of the menstruations, and you want a question, answers from our experts, so please you can ask. Otherwise we can wind up that. So we can answer in the briefly. We can answer. Okay.
But thank you so much to our panelists for such a comprehensive and informative session. Unfortunately, we are short on time today. Understanding menstrual health from the medical and holistic perspective is essential, and your insights today have been truly valuable. So thank you so much. Can we give them a big hand for giving them insights, their experiences, and I totally agree. Now I can figure out why do I behave in such a irritating way, and my family gets irritated every time. Dr. Shehla, I guess, told me that PMS is actually something we need to be recognize and identify and accept first. Thank you so much everyone for the session. Now I would like to request Executive Director of Gramalaya, Mr. M. Englovan, to kindly join and present mementos to Dr. Santosh Gupta. Meanwhile, can we just clap and give them little bit of grateful that they shared their knowledge today with us, their time, their experience. Truly, truly grateful, sir. Thank you so much for joining the session today. Sir, I would like to request you to give mementos to our other panelists as well. I would like to call Dr. Divya. Thank you, ma'am, for giving your time today. Thank you so much, ma'am. I am loving that we have male audience here. They should know more about PMS. But let's have the claps rolling. Thank you, ma'am. Thank you so much for being the part of the panel. Next, I would like to request Dr. Jamal to please step forward. Loved the way she told us about the PMS, how to identify it in the most humorous manner, I guess. Thank you so much, ma'am, for your time, for sharing the in-depths of what PMS actually is and how to identify it. Thank you, ma'am, for your knowledge. I would like, we have Dr. Smita Dube with us. Thank you so much, ma'am, for being the part of the panel, sharing your knowledge and expertise in the field. Gynecologists are something I have been referring to since I was in my teenage years. And
Along with you.
no. Awesome. I guess we are done. Thank you so much. Thank you.